Hi, good morning. I am Dr. Kailas Mirche, working as consultant neurologist at Citizens Hospital, Hyderabad. Today we will discuss something about the most commonest symptom with which patients come to neurology OPD, that's headache. So basically there are two types of headache. One is called as the primary headache, in which we have tension type headache and migraine, and the other one is the secondary headache, where the patients have secondary causes of headache like high blood pressure or infection inside the brain, or sometimes tumor itself can present with headaches, or some arteriovenous malformations or bleeding inside the brain itself can cause these headaches. So these are all included under the secondary causes of headache. Basically we will discuss about the primary headaches today, among which migraine and tension type headaches are the commonest one. So what exactly is migraine? What is the prevalence of migraine? So WHO has declared migraine as the 8th most bothersome disorder, and it is the 4th most bothersome disorder in women. So 1 among 4 females, 1 among 10 males, 1 among 11 children will have migraine headaches. So what exactly is migraine? It's usually a unilateral headache which is a throbbing type, severe, moderate to severe headache, usually lasts for 4 to 72 hours. Some of the patients, if they don't take medicine, it can extend more than 72 hours. Usually associated with nausea, and some of the patients may have vomiting associated with nausea, and some of the patients they feel relieved after the vomiting. So some of the patients they even complain of neck pain during the episode of headache. So what are the different phases of migraine? Migraine is usually starts with an aura. Patients will know that they are going to get the whole episode of headache in the form of lightheadedness, epigastric pain, burning sensation, burps, a bit of depression, and photophobia, light insensitivity and sound insensitivity to start with, which is usually followed by a severe headache, a throbbing headache, moderate to severe intensity, lasting for almost more than 4 hours. Migraine is more common in females when compared to males. It affects usually the age group between 15 to 45. The incidence is 1:3 in males to females, and postmenopausal women will have a decrease in the intensity and even frequency of headaches. That itself states that it's a hormonally driven headache. So what are the trigger factors for migraine headaches? Usually the most common trigger factor in most of the patients is stress. Stress is the biggest risk factor for migraine headaches, and along with stress, if you have lack of sleep, if you are not drinking enough water, if you are dehydrated, and there are some other triggers like sunlight, direct exposing to direct sunlight, listening to excessive music or sounds, skipping food is the one of the most common precipitating factor, and even smell. Some of the patients they have higher sensitivity to the incense sticks which we use for puja, and even the perfumes they can't tolerate. It can trigger these. And there are some food habits which can trigger these migraine headaches, like tea which contains tannin, coffee which contains caffeine, cheese, Chinese foods. Basically the mayonnaise sauce which they use in Chinese foods contains something called as monosodium glutamate, which is a trigger for migraine headaches. Along with this, some of the patients, if they keep their hair wet for long after a head bath, will also have lot of headaches on those days. And some of the patients during traveling they get these headaches. So basically these are all the trigger factors which if the patients avoid, they can have decreased number of and decreased intensity of headaches. So how to manage migraine headaches? Usually most of the patients, if they reduce the trigger factors, the frequency and intensity of headaches by itself will come down. Like adequate hydration, they should drink at least 2.5 to 3 liters of water per day. They should avoid foods like tea, coffee, chocolate, cheese and Chinese foods, and avoid skipping food. Basically patients should take breakfast, lunch, dinner on the same time every day. They are not supposed to skip food. 8 hours of sleep is must, adequate sleep, And nowadays, because of gadgets, patients are using excessive mobiles by putting off all the lights at night. That should be avoided. Light itself, the mobile light itself can cause these migraine headaches. It can induce, it can trigger migraine headaches. And you should use goggles while going to sunlight, because UV rays, the sunlight itself is a trigger factor for migraine. Avoid using perfumes, avoid using agarbatti incense sticks at home, and any pungent odor, you are supposed to avoid all that. Yeah, coming to medications, usually basically there are two types of medications for migraine. One is to treat the acute attack of headaches. So we have some analgesics, painkillers, which will treat your acute episodes. The ongoing headaches will be treated by those medications. And if you have more than 4 episodes of headache per month, then we know that next month also you are going to get headaches. So we have some medications which are called as prophylactic medication for migraine. If you start using those medications, you will not be getting the further episodes of headache. So we have some medications. Recently we have come up with some injections. Those are a monthly once injection you need to take. If you take, the intensity, frequency of these migraine headaches will come down. It's a monthly injection. If you have a chronic migraine, if you have an episodic migraine, that injection is indicated in those patients. And I will tell you some of the red flag signs for headache. In those cases, you have to meet the neurophysician as early as possible. These are any patient who has crossed 60 years, any elderly patients, new onset of headache, you have to come to hospital, because there are so many things which we miss out in elderly patients if they have recurrent headaches. So imaging is must in those patients in the form of either CT scan or MRI. And the second, if the headache intensity is reaching to its peak in less than a minute, if the headache has started now and it is reaching its peak in less than a minute, you should consult the doctor immediately, because that is one of the reason for intracranial hemorrhage. It's a bleeding inside the brain can present with such headaches. So you have to come to hospital. And any patient along with headache, if they have fever, neck pain, vomiting, those patients should also come to the hospital. And if they are losing weight, if there is significant weight loss along with headache, you are supposed to meet the doctor. You have to consult a neurophysician if there is a progressive increase in the headache. If suppose you have suppose 5 intensity of headache today, if it is increasing to 7, 9 tomorrow, day after tomorrow, that is one of the condition where you need to consult the neurophysician as early as possible. And some patients will have headache on sneezing or coughing. So these are the patients, usually there is raised intracranial pressure in those patients. If they sneeze, if they cough, they get these headaches. So those patients also should come to the hospital as early as possible to consult the neurophysician. So this is all about migraine headache, the causes, the trigger factors, the preventive measures, the medications, the lifestyle changes, and ultimately the red flag signs. If they are there, then you have to come to the hospital as early as possible. Thank you.